Hello, and welcome back to our channel. I'm here today to talk about something that affects millions of us, especially as we enter our middle years and beyond. If you're over 45, this video could quite literally save your life: heart disease. Those two words might make you uncomfortable, but here's the truth. Knowledge is power, and understanding heart disease is one of the most important things you can do for your health and your family's peace of mind. Maybe you felt that strange pressure in your chest during your morning walk. Perhaps your doctor mentioned your cholesterol numbers at your last checkup. Or maybe you're here because someone you love has been affected by heart disease. Whatever brought you here today, you're in the right place. Over the next few minutes, we're going to explore everything you need to know about heart disease, specifically focusing on how it affects adults over 45. We'll cover what heart disease really is, why your risk increases dramatically after 45, the warning signs you absolutely cannot ignore, and most importantly, what you can do starting today to protect yourself. Let's start with some sobering facts. Heart disease is the leading cause of death worldwide and here in the United States. But here's what's particularly important for our viewers. The statistics change dramatically once you hit 45. Among adults aged 18 to 44, only about 1% have heart disease. But watch what happens as we age. For adults aged 45 to 64, that number jumps to nearly 6%. And for those 65 and older, it reaches over 18%. That means nearly 1 in 5 adults over 65 has heart disease. If you live in a rural area, your risk is even higher. Adults in non-metropolitan areas show heart disease rates of nearly 9% compared to less than 6% in cities. This isn't just about statistics. This is about you, your spouse, your friends, and your community. So what exactly is heart disease? Let me break this down in simple terms. The most common type is coronary heart disease, also called ischemic heart disease. Think of your heart as a muscle that needs its own blood supply to function. Your coronary arteries are like highways that deliver oxygen-rich blood to your heart muscle. Over time, these highways can become clogged with a buildup of fats, cholesterol, and other substances that form what we call plaques. It's like sediment building up in old pipes. As these plaques grow, they narrow your arteries, reducing blood flow to your heart. This process develops gradually over many years, often without any symptoms. That's why heart disease is sometimes called a silent killer. You might feel perfectly fine while your arteries are slowly becoming more and more blocked. This brings us to angina, and this is a term you need to know. Angina is chest pain or pressure that happens when your heart muscle isn't getting enough blood. The word actually comes from Latin meaning to strangle the chest, which gives you an idea of how it feels. There are two types you should understand. Stable angina happens predictably, maybe when you're climbing stairs or feeling stressed. It lasts a few minutes and goes away when you rest. Unstable angina is more dangerous. It can happen even when you're resting and may signal that a heart attack is coming. Here's something crucial. The severity of your chest pain doesn't always match how serious your heart disease is. Some people have terrible pain with relatively minor blockages, while others have severe artery narrowing with minimal symptoms. This is especially important for those of us over 45, because we might have what doctors call atypical presentations. Now let's talk about heart attacks, medically called myocardial infarctions. A heart attack happens when blood supply to part of your heart muscle is completely cut off, usually because a blood clot forms after one of those plaques ruptures. Here's the critical timeline. Your heart muscle cells start suffering damage within 30 minutes of losing blood flow. If blood flow isn't restored quickly, the damage becomes permanent. This is why we say time is muscle in emergency medicine. The most severe type is called a STEMI. That's STC segment elevation myocardial infarction. This requires immediate emergency treatment to minimize heart damage. Every minute counts. Why age 45 is the turning point? You might wonder why we keep emphasizing age 45. There are several reasons why your heart disease risk accelerates at this age. First, you've had more years of exposure to risk factors like high blood pressure, high cholesterol, and lifestyle factors. Second, your body's natural repair mechanisms aren't as efficient as they were in your 20s and 30s. Third, if you're a woman, the approach to menopause means losing estrogen's protective effects on your heart. After menopause, women's heart disease risk equals that of men. For men, the risk starts climbing earlier. But for everyone, the cumulative effects of aging and risk factors create a perfect storm after 45. The prevention revolution. Here's the good news, and this is really important. Up to 80% of heart disease is preventable. Let me repeat that. 4 out of 5 cases of heart disease could be prevented with the right approach. The Centers for Disease Control identifies 4 key lifestyle changes: maintaining a healthy diet, engaging in regular physical activity, avoiding tobacco, and moderating alcohol consumption. Let's talk about diet first. This doesn't mean you need to eat like a rabbit, but you do need to be smart about your choices. Focus on fresh fruits and vegetables. Limit processed foods high in saturated and trans fats. Reduce your sodium intake to help control blood pressure, and limit sugar to prevent or control diabetes. The Mediterranean diet has shown remarkable results in clinical trials. Think olive oil instead of butter, fish twice a week, plenty of fruits and vegetables, whole grains, and moderate amounts of red wine if you drink alcohol. The exercise prescription. Physical activity is like medicine for your heart. The Surgeon General recommends 2.5 hours of moderate intensity exercise every week. That's just 30 minutes, 5 days a week. We're talking about brisk walking, swimming, cycling, or dancing. Activities you can actually enjoy. If you already have heart disease, don't worry. Exercise is still beneficial, but it should be supervised and gradually increased. Cardiac rehabilitation programs have shown tremendous benefits for people who've had heart attacks or other cardiac events. The key is to start where you are and build gradually. If you've been sedentary, even a 10-minute walk after dinner is a great start. The smoking conversation. If you smoke, we need to have a serious conversation. Smoking is one of the most significant risk factors for heart disease, and the good news is that it's completely modifiable. Here's something remarkable. The benefits of quitting smoking start within hours. Your risk of heart attack begins dropping immediately and continues to improve over time. If you've already had a heart attack, quitting smoking quickly reduces your risk of future cardiac events to nearly that of someone who never smoked. I know quitting is difficult, But at our age, it's not just important. It's urgent. Talk to your doctor about smoking cessation programs, medications, and support systems. Know your numbers. Know your numbers isn't just a catchy phrase. It's a life-saving strategy. You need to know your blood pressure, cholesterol levels, and blood sugar levels. These numbers tell the story of your cardiovascular risk. High blood pressure is called the silent killer because it often has no symptoms while it's damaging your arteries and heart. Normal blood pressure is less than 120/80. If yours is consistently higher, you need treatment. Your cholesterol numbers are equally important. You want your LDL, bad cholesterol, to be low and your HDL, good cholesterol, to be high. If you have heart disease, your LDL should be below 70 mg/dl. When medical treatment is needed, sometimes, despite our best efforts, medical treatment becomes necessary. Modern heart disease treatment has come a long way, and the options are more effective than ever. Medications might include beta blockers to slow your heart rate and reduce blood pressure, calcium channel blockers to relax your arteries, or nitrates to improve blood flow. If you've had a heart attack, you'll likely need antiplatelet therapy like aspirin to prevent blood clots. Statin medications are often prescribed to lower cholesterol, and ACE inhibitors, or ARBs, might be used to protect your heart and kidneys. For severe blockages, procedures like angioplasty can open blocked arteries, often with the placement of a stent to keep the artery open. In some cases, bypass surgery might be recommended to create new pathways for blood flow around blocked arteries. Living well with heart disease. If you've been diagnosed with heart disease, it's not the end of the world. Millions of people live full, active lives with heart disease. The key is working with your healthcare team, taking medications as prescribed, maintaining healthy lifestyle habits, and monitoring your symptoms. Quality of life is just as important as longevity. Modern treatment approaches focus on helping you maintain your independence, enjoy activities you love, and spend quality time with family and friends. Regular follow-up with your doctor is crucial. This isn't just about checking boxes. It's about catching changes early and adjusting your treatment plan as needed. Special considerations for our age group. As we age, heart disease management becomes more complex. We're more likely to have other health conditions like diabetes, arthritis, or kidney disease. We might be taking multiple medications that could interact with heart medications. Frailty becomes a consideration for some older adults with heart disease. This doesn't mean you're weak. It's a medical condition that affects how your body responds to stress and illness. Your doctor can assess for frailty and adjust your treatment plan accordingly. Mental health is equally important. Heart disease can affect your mood, energy levels, and overall outlook. Don't ignore depression or anxiety. They're treatable, and addressing them can actually improve your heart health. The family factor. Heart disease often runs in families, so your family history matters. If you have a parent or sibling who developed heart disease before age 55, your risk is higher. While you can't change your genes, you can be more vigilant about prevention and screening. Share what you learn with your family members. Heart-healthy habits benefit everyone, regardless of their risk level. Cooking healthy meals together, taking family walks, and supporting each other in lifestyle changes can make prevention easier and more enjoyable. Looking forward. The field of cardiology continues to advance rapidly. New medications, less invasive procedures, and better understanding of prevention strategies offer hope for even better outcomes in the future. Personalized medicine is becoming more common, with treatments tailored to your specific genetic makeup and risk factors. Remote monitoring technologies allow doctors to keep track of your heart health between visits. Research into the connection between heart health and brain health, immune function, and overall aging continues to reveal new opportunities for maintaining health as we age. Your action plan. Let's wrap up with your action plan. If you're over 45, here's what you need to do. First, schedule a comprehensive physical exam if you haven't had one recently. Know your numbers, blood pressure, cholesterol, and blood sugar. Second, honestly assess your lifestyle. Are you eating well? Getting enough exercise? If you smoke, make a quit plan. If you drink heavily, consider cutting back. Third, pay attention to your body. Don't ignore chest pain, shortness of breath, or unusual fatigue. These could be warning signs that need immediate attention. Fourth, build a relationship with a healthcare provider you trust. Heart disease prevention and management require ongoing partnership with your medical team. Finally, remember that small changes can make a big difference. You don't need to transform your entire life overnight. Start with 1 or 2 changes and build from there. Final thoughts. Heart disease is serious, but it's not a death sentence. With the right knowledge, lifestyle choices, and medical care when needed, you can protect your heart and enjoy many healthy years ahead. Your heart has been beating faithfully for decades, working 24/7 to keep you alive. Isn't it time to return the favor by taking care of it? Thank you for watching. If this video was helpful, please give it a thumbs up and subscribe for more health content designed specifically for adults like us. Share it with friends and family who might benefit from this information. Remember, when it comes to your heart health, you're not just a statistic. You're someone's parent, spouse, friend, or grandparent. The people who love you want you around for many years to come. Take care of your heart, and it will take care of you. Until next time, stay healthy and keep that heart strong.